Hi, my name is Cindy, and I'm going to give a short little talk about three parts of nursing. One is the Standards for Quality Education in Nursing, which is the QSEN. And it was a project that was developed to educate nursing students on two important aspects of patient care, which are the patient safety and healthcare quality. The national study was funded by the Robert Wood Johnson Foundation in 2005. This was a three-phase program. Phase 1 consisted of 6 competencies: patient-centered education and patient-centered care, which addresses the holistic, compassionate, and comprehensive care, which is based on the patient values, needs, and preferences. The patients are a full partner in this particular aspect, and they have control over the provision of patient-centered care. They have the right to refuse care that is being administered or treatments that they choose not to take. Teamwork and collaboration was the second goal or competency, and that was that nurses, along with other healthcare team professionals, use open communication amongst themselves. They collaborate efficiently and respectfully with each other, and they have a mutual decision making in regards to achieving the quality of care. Evidence-based practice is the next one, and this is the use of current evidence that is integrated into the care to support clinical expertise in providing optimal health care for our clients and patients. And quality improvement is number 4, and that measures data and monitoring patient outcomes, is a method of developing changes for the continuing improvement in both the quality and safety of healthcare delivery. Informatics is the next, and that's number 5. And that is the use of technology for effective communication amongst team members. And now it's also used for patients to monitor their healthcare records after discharge from facilities. And it's for the management of errors that should occur, and the support of collaborative decision making. In some facilities, they have radiologists and neurologists that evaluate patients with the information that is sent to them over the internet, and then they send back their recommendations per the internet, which is a secured site between the physicians and the facility, so that the patients are getting care for problems that weren't able to be handled in those individual facilities in the past. And safety is the last one, which is the minimization of both risk and harm to both patients and healthcare providers through self-esteem and system evaluation. Phase 3 was also funded by the Robert Wood Johnson Foundation, and that was in 2007. This phase had 2 goals. The first goal was the development and launch of a website which allowed the education of teaching strategies and resources for facilities and nurses and educational campuses, so that there was a generalized ability for everyone to access the upcoming issues in regards to healthcare. And also the collaboration with organizations representing advanced practice nurses in the development of competencies for the graduate educational programs. 15 schools, after this was initiated, became pilot sites for the curriculum revision, so they were able to meet the QSEN competencies for the graduate programs. Phase 3, the American College of Nursing, which is also the AACN, received funding to complete this phase. Now, the Robert Wood Foundation was also included in this, and they also had input into how phase 3 would be enacted. And these goals consisted of development of faculty expertise needed to teach the competencies needed for the graduate programs, to incorporate competencies in textbooks so that the textbooks were upgraded to the current practices and not the ones that were done 20, 30 years ago. And implement innovative teaching strategies and the assistance of both licensure and accreditation processes. In February 2012, the Robert Wood Johnson Foundation supported the AACN with the development of a new project, and this one was to establish national QSEN competencies for graduate education. This project had 4 primary goals. The first was development of a consensus with competencies in graduate nursing programs that must be mastered in both quality and safety. The second was learning resources created with interactive materials preparing graduate students in the delivery of quality and safe care. The third is to host workshops for the training of both faculty and facilities to enable the facilitation of implementation for competencies in the graduate curriculum. And fourth was development of an online collaborative of education materials for use by graduate level educators and their clinical partners. These competencies for graduate level QSENs focused on knowledge, skills, and attitudes required for advanced practice nurses to effectively improve both the safety and the quality in healthcare delivery, and they were implemented by the AACN in September of 2012. Next, we're going to talk about ATIs, which, as you can see from the poster there, it's an assessment technology incorporated. And what it does is it provides content mastery, comprehensive predictors of examinations. What this means is that it takes examples of questions that are formatted in different methods, and there's a general website, and it allows the educator to pull these questions and use them in their classrooms for testing purposes to see how well the student is able to utilize the education that's been provided to have the proper answers. It evaluates the student's learning on what's been taught and how well they comprehend and understand it. Now, ATI also has developed a curriculum development site which assists nurse educators in the facilitation and development of their curriculum within a nursing program. This site was developed by nurse educators for the use of nurse educators. The documents are stored in a central repository, and they're electronically generated for nurse educators to utilize within their programs. It ensures that the program remains on track and acknowledges both education and the student to succeed in the program. It also has a website, and when I went on the website, I discovered that students in any program, whether it be a practical nurse program or a registered nurse program, and under the registered nurse program, if it's a baccalaureate or an associate program, they can make those choices. It allows the student to choose where they are in their specific program, and it offers tutoring, it offers educational methods, and it also has learning activities that assist the student in being able to combine what they're learning with what they need to do in a clinical area. In the programs currently in use, a lot of students do not have access to a lot of the diseases and issues that are studied in classrooms in a clinical situation. depending on where they're attending their school. So this enables the student to be able to see these things in action and how they would determine if issues were needed to be addressed for the client in those situations. The time frames are specific for these tutoring instances. And after they complete a curriculum, it is then forwarded to their university or educational program so that their instructor can see that what they have done on the ATA website. ATA programs, with the use of formalized external testing, does assist with evaluation of where the student's progress is within the components of any given program. It can also be linked to accreditation criteria such as the NCLEX and other test plans. ATI provides both content mastery along with a comprehensive preceptor examinations that provides indicators of where the students are in the individual learning process. The last thing that I'm going to talk about or discuss is going to be the CCNE, which stands for Process with Evidence Supporting. It is an accreditation that supports and encourages continuing self-assessment by both nursing programs and the continued growth and improvement by collegiate professionals in their education and post-baccalaureate nurse residency programs. It was developed in 1988 with the sole purpose of accrediting the baccalaureate and higher degree programs only. That includes the Masters of Science in Nursing and the Doctorate in Nursing program. Its mission is the focus on innovation, autonomy, and creativity. It is an autonomous accrediting agency, and it ensures quality and integrity of programs in nursing. It is governed by a 13-member board of commissioners, and that board is composed of deans from nursing programs, of which 3 are commissioners. There are 3 faculty commissioners, 2 professional consumer commissioners, 2 public consumer commissioners, and 3 practicing nurses commissioners. They have 4 standards, which is the mission and governance, institutional commitment and resource, curriculum and teaching learning practices, and program effectiveness. In order to be accredited by the CCNE, there is an accreditation process that the educational programs institutions must perform. The first is the nursing program develops a self-study report, which is then used to perform a self-assessment of how that individual program meets the CCNE standards and key elements. Next, an on-site visit is conducted, during which peer evaluation teams validate the self-study findings that were done by the facility. The peer evaluation team is identified as a fact-finding team. They then prepare a report addressing if the program is compliant with the CCNE standards and key elements. Nursing program is then sent a report, and the administrator of that nursing program has an opportunity to respond to the report and clarify any issues of confusion or question that the fact-finding team may have uncovered while they were on the grounds of the facility. The Accreditation Review Committee, which is ARC, then reviews the self-study, the evaluation team report, and the nursing program's response. At that time, the ARC team will then make a recommendation to the Board of Commissioners regarding accreditation and what they feel or how they feel the program either meets the accreditation standards or is deficient in accreditation standards. The CCNE's Board of Commissioners then reviews the ARC recommendations, but it is solely the commissioner's responsibility for deciding whether or not that grant is going to be approved, whether it is the initial grant or for continuing approval after an inspection has been done, or to deny approval of a facility of higher education that had previously had the approval of the CCNE. And if they deny it, they may withdraw the approval. The Board of Commissioners do periodically review nursing programs between the accreditation times to monitor that in between the evaluation times, the program is still maintaining the standards that the CCNE has set. Thank you very much for allowing me time to talk about these 3 issues in nursing.